Hey, practice owners, back with another edition of Coming Back Stronger. I'm super excited to have one of my favorite people in dentistry on, Christine Taxin.
Hi, everybody.
Christine is if you don't know Christine, maybe you practiced on a different planet or something for a while. She is medical dental billing is sort of her thing. She is the go-to person. And in sort of the vein of what can you be doing now to get your practice ready for coming back stronger, Christine was one of the first people that popped in my head, and I thought, there are probably a lot of things you can be doing with this time you have, this gift of time, that you would always say, we need to do that, but we'll do it when we get time. Well, you have the time right now, so at least probably a few more weeks. So with that, I kind of like to dive right in. Christine is always a wealth of information, so get a paper and pen handy and be ready. So, Christine, how you doing?
I'm good, Steve. How are you?
Awesome. You're quarantined, and you're a road warrior. So,
yeah.
I imagine you like packing a suitcase and going to the living room or something.
Yeah, it's still back
like
here waiting, waiting to roll out, but I think that'll be a while. I am enjoying a little bit of my time because I've been working with so many practices across the country who understand that some things they just never got done, like you said.
Right.
And they're doing it now. So they're studying with me with coding and what could I implement when I go back. That would be a higher profitability and see less patients, one of those things. So it's been an experience, and everything I'm going to share today, honestly, came from a little bit from this doctor and a little bit from that doctor, just talking together. And so I put a list together just specifically for our call on amazing information, I believe. So I'm going to start going.
Awesome.
All right?
Yeah, absolutely. Thank you.
Well, one of the first things I was called upon was about teledentistry. How do I code it? How do I bill it? What's going on? And how could I utilize it? So the best plan of action that we have seen done is teledentistry consultations with anybody that's calling you for an emergency visit. Now, how do you get those emergencies? People that have never been to your practice maybe before because they were going to those emergency rooms at 3 o'clock in the morning. And don't forget, you are being put on a situation where you don't have to worry about insurance at this point. You really don't, because they are emergency patients. So you can charge and bill later. Bill for them on the insurance plan. And I want to make sure that everybody knows there is a criteria of what is an emergency. So we have to pay attention to that criteria. But doctors have been seeing the strangest emergencies, and getting to talk to them first about it. And actually, you could do an intraoral picture just by doing a Zoom. So, there's quite a few things you can bill, and you can put them on an antibiotic. So my feeling was, why are we running back and forth and exposing ourselves by going out every 5 minutes to see these people? We started to triage online. And then make a day where we could have somebody else in the office with the doctor, prevent any issues. We booked every patient, on that one day. And what we did, and what other doctors are doing, is they come to the parking lot. So if your office has a parking lot, they come, they do not get out of their car. They text you and let you know they're in the car, in the parking lot. If we're finishing up a patient, they wait in their car. We let them know that on our teledentistry. When the last patient leaves, we're sterilizing everything. When we're ready for the next patient, the patient's called in. They are escorted over to the bathroom. They're given antibiotic wash for their hands, their face. They're given masks, and we bring them into the operatory. We're asking our patients to wear gloves because they will touch the chair and everything. And even though we're sterilizing it, you know what? We wear gloves, they can wear gloves.
Right.
So we're having them wear gloves. We are asking if they have a fever, and we started taking patients' fevers. We take blood pressure, so it's not an invasive thing. Just take a fever and make sure for your own protection and your team, whoever's with you. We're seeing those emergencies in that order. And believe it or not, Steve, patients have been grateful.
Well, it was interesting when you said that. 70, I mean, there are statistics, 70% of dental emergencies are seen in an emergency room.
Yep.
They don't call the dentist first, they go to the emergency room. Well, today, when you walk in the emergency room, they're going to say, hey, if you don't have the virus or a gunshot wound or not stabbed, get out of here. So if you're a doc who's trying to decide whether to practice or not, I have to think patients are calling around, because again, 7 out of 10 go to the emergency room, which they can't now. So it's a good opportunity to sort of build those skills.
Yes,
maybe teach yourself how to do teledentistry.
Right. Well, there's a lot of programs out there, and right now there is no restriction by law on using Facebook or Zoom.
Right.
So, take advantage of that. We're doing it right now. You're seeing us do it. And I'm educating that way more than the average time, because I can't go to their office. I can't do a big meeting.
Right.
So doctors are calling, and they're training their whole teams. Because with Zoom, I could have 7, 10 people on, even from their own locations.
Right.
So it's been an experience in keeping the team together for the doctors, giving the team the opportunity to learn more information, even this whole setup. It's going to require the team to reset up their practice. How are we going to stay safe?
Right.
So everybody's going to, my recommendation right now is doctors, we need to start to order our supplies. It's going to take a while. So that's the first thing you have to do, is you have to worry about how are you going to protect your team and what supplies do you need so you could purchase, because you're going to be on a list, because everything is at a shortage.
Right.
So let's make a list. Know that you're going to need extra masks for a front desk. There is no such thing as nobody wearing one. No such thing as the front desk sitting without gloves on, because we just need to have that extra protection in the beginning. And I think that the team, we all want to go back to work. I can't wait to go back to work. But I know I'm going to protect myself.
Yes. Yeah.
More different than the way I did. I always, Steve, went over and shook hands to the audience.
Right.
Before.
Yep.
So, I can't do that, but I can still be personal away from them and make them feel comfortable. And we can do that in offices. So as long as you know what the protocol is, you need to have throwaway coats.
Right.
And more like a surgical procedure that doctors would wear. And let your patients know. Make a list and put it on your website of what you will do to protect them. What is the sterilization techniques? What are the criteria? You know what? We're the only doctors in all of the criteria that always wore masks when we treated a patient.
Right.
You go to your MD, he's not wearing a mask.
Right.
He's not wearing gloves.
Right.
They're still taking your blood, but they're still touching you. So we have an advantage here, I think, Steve. I think that we have an advantage because we have shown patients what sterilization is and what they could expect. But now we have to emphasize that we have these high standards and that they will be protected by coming into our office.
Right. Well, let me ask you this, and two things, and I agree with you on the teledentistry has a place. I don't know what it is. Nobody knows what it is, but and I don't even think that it's because of a coronavirus. I think it's because when you start to use it, it becomes an easier way to see patients for certain things. Now you can't prep a crown over Zoom.
No, but you can start to free yourself up from running in on a regular basis, not just now.
So I know HIPAA is suspended for telemedicine, telepsych, telecounseling, and teledentistry through I think the end of the year. Is that right?
Yeah.
It'll be extended, but so if you're doing it, it's awesome. You know, no harm, no foul. They're not writing any fines today, so you can do it literally over Facebook or Zoom or FaceTime or whatever you want to do. But you should probably have your staff researching. Okay, once we come back in June, July, August, whenever it is, and we want to keep doing this because our patients like it, our patients/customers like it. And OSHA may say that we have to do it or whatever happens, it's better to be knowledgeable now on the HIPAA pieces.
Yes.
And the second part of that is, if you're doing that, and you may not know, I don't know, can you bill for a teledentistry consult? In medicine, you can.
Yes.
And they do.
Yes,
so
you
can.
can.
You do dentistry right now?
Yes.
Okay.
You're billing a couple of different things when you do a teledentistry. Okay. The first thing you're billing is the teledentistry itself. There's two codes. One is a recorded program and one is live, like we're doing right now.
Okay.
Of course, most doctors are going to do live. So that would be the first code you're billing. The second code you're billing is a problem-focused exam. You're actually billing the problem-focused exam because we're seeing an emergency right now. Okay. So you can't treat, but you can diagnose.
Okay.
Okay, because most patients that call on an emergency are calling with a problem. So and this is good training for doctors across the country because this is how medicine works.
Yeah.
A patient gives you signs and symptoms, tells you what's wrong. Then you can actually let them put the camera near them, however close it is, open, look in. I could get closer and you could see down to my tonsils. Okay. So you can charge for 2D film. Okay. Intraoral pictures, just like you would in your office. Only on teledentistry, because you can't do a clinical exam, they're paying for those intraoral pictures.
Ah, okay. Yeah.
So it's another code to bill. So all in all, you could be billing 3 different procedures. The teledentistry, the exam, and the intraoral pictures. So it's not that horrible.
And that's what you can do now.
Now.
I think the important thing is when you, in the sort of the construct of coming back stronger, one of the things I know, and I've told this story before, I had a Telemed visit 2 weeks ago that I might have had 15 times in my life. Every year for 15 years, I have to go see my doc and get some, I think it's cholesterol medicine. And, I have to get in my car, travel over there, sit in the waiting room. And so 2 weeks ago, I had an appointment and I got a call and I thought they were going to call to cancel. And his assistant said, you have an appointment tomorrow at 3. Would you like to do it over the phone? And I said, well, sure. And she said, okay, I'm going to send you a link. Just tap the link. It installed a little app on the back end. And then she said, when it's time for your appointment, just click here and come to your appointment. So I did it. There he is on the other end. And I've known the guy for a long time. So we kind of chatted. And he said, he did exactly what he did. He said, do you have this? Do you this? Anything changed? Okay, here you go. Christine, it was 3 minutes or whatever. And and he said, oh, and then on top of it, he said, and by the way, do you want us just to go ahead and do these by mail? I can check a box here and they'll just show up every month or whatever. I said, well, sure. 48 hours later, Paula said, hey, you got a box. And, it was my prescription. I didn't have to get out of the chair. So I told him, I said, are you going to do this? Because I love it. I mean, you just saved me 3 hours over the course of time we've been doing this. It was a work week that all we had to do was I had to answer 6 questions. Now, if it was something serious and I said, yes, I've gained 25 pounds or something had changed, he would probably stop and say, okay, we're going to need to schedule you next week at 3 or whatever,
right,
and handed me off. But if not, we go to the finish. So, and I asked him, I said, have you done this for long? And he goes, I'm going to tell you the truth. We started doing them yesterday. And he goes, I've decided since then that I'm going to dedicate a morning a week to begin with, maybe 2, to just these kind of visits. And this is the only time we schedule them. He said, I can come in, I can see 25 patients.
Yeah.
And he said, and the worst thing is, he said, we've been talking about this for 5 years and I've been fighting them the whole time because I didn't want to learn how to do it. And he said, now that I've done a couple, he said, because the same thing, I felt like if you weren't here in the room with me, I couldn't be a good doctor. He goes, I realized, yeah, you're going to be in the room with me so we can chat about, the wife and kids and, ask you 6 questions and I can be chatty, but I'm really already 20 minutes behind. He goes, and I said, so it just works for everybody. Has nothing.
It really is amazing.
And he's billing. He said, I'm billing you the same thing. And he said, we both win. So my point to that is, it's not about the virus as much as it is about
long term.
Good idea.
The future is here, and we've had several companies, that have been talking and selling teledentistry,
right? But
doctors are resistant to change,
right?
And now they're smart enough to know, Steve. Say, what am I going to do?
Right.
So these are one of the things that you could be making a little income today. Not a lot, because you're not doing major work. But the people that you're seeing online like that, you're actually making a connection with them.
Yes. Yeah.
Because they are seeing you, you're seeing them. So that is a connection. Let's put the cards on the table. They're probably seeing their families that way. Oh, that's how I'm visiting my grandkids.
Well, yours are scattered.
Yeah, my kids are scattered normally. So we've been using Zoom for a couple of years now. So it is a way of keeping close in a different way, different than we would normally say. A big Italian family get together is no longer in one house.
Right.
And that's okay.
Well, you also, I've got practices that have reached out and said, because we did a thing on Zoom and I told docs, just learn how to use it. And I told the story of, my family is the same way. We're scattered. And I don't remember what it was, but one Sunday afternoon, it took a little while for my dad. He's 80 and in South Florida. Took him a little while to figure it out and get on. But once he got on, suddenly there's a screen full of everybody. And I said, you can use it, just learn it. So I've gotten all these emails back about docs who tell me that that's how they're having team meetings right now.
Yes, now.
And, there's 12 people on the screen and they all chat and they share and, their cat jumps up and they're cooking dinner but it's a way to stay connected. So it's not going back. You can't put this genie back in the bottle.
No, it'll never go. In fact, I think what we are going to see is a whole new way of practicing. No more filled waiting rooms. People are not going to want to do it. People are now going to value their time even more than before. And as you said, 3 hours to go back and forth, between going back and forth and then sitting and waiting and then having the treatment. You're not going to want to do it anymore like that.
And he billed me the exact same. In fact, I think it might have been more. He said, there's actually, so he said, I billed you for the visit, but I'm going to bill you. And I said, you're not going to hurt my feelings. I just want to know how it works. and then he built a teledentistry code
Right.
in addition to that. So, and that's something, you know, this may, do you have, I know you have a ton of resources.
Yes.
That you give away very generously.
Yes, I do.
Before I lose that, if somebody's listening and says, awesome, what are those codes? Do you have those up on your site?
Yeah, I mean, I could put them up if you want. You want me to share them?
Absolutely.
Would that be okay?
Yeah, we'll put your website. Where would they go? Would they do the links to success?
Yeah, say links2success.biz.
Okay, and it's LINKS, the number 2.
Number 2. Success. SU. Yeah, and
I'll put that down below in the notes here. So, but I know you have a lot of resources that you share very freely, and we appreciate that.
Oh yeah, and this is, I mean, you know, there are companies that are doing this for free for a couple of months also.
Okay.
So I want to share them because they'll be able to, let me just open this up so that I could.
Yeah, and we'll get, and Christine, you're sort of the coding guru. So,
yeah.
And I know how to bundle, and especially, so for you, we kind of cover that. For you, medical has always been big. You're all about the.
I'm all about
medical dental.
This is actually bringing us closer to the way practice medical practices. You're diagnosing on teledentistry. That's what you could do.
Yes.
Diagnose your patient. By diagnosing your patient, you're actually teaching yourself a little bit on the changes that are going to be made for dentistry. And you know, the weird thing is, the minute this virus hit, I was traveling. I was at the ADA actual code revision meeting, and we were wearing masks at the meeting and distancing apart at the tables, but it wasn't like a shutdown yet, right? Beginning of March. And we're all sitting there, and I'm saying, this is medicine happening today, because at the ADA meeting, everything was about diagnostic codes. And because we now have the claim form with diagnostic areas, we changed the claim form to match a medical claim form, because we're no longer using upper right or lower right. We're using qualifiers, just like medical. So 10 is upper right, 00 is full mouth. So we're changing, and doctors are seeing this, but they're not comprehending. We're there.
Okay.
There. So, and now with teledentistry, diagnosing is what you're doing.
Right. I know that, and that is a thing that dentists, typically didn't do. You saw the patient, you fixed the patient, you moved on. You didn't think of the diagnosing piece. And so I paid attention when, in your talks, Christine.
Yeah. So here you are really learning 2 skills.
Yeah. So, but it is
make 2 skills by dealing with teledentistry.
Okay.
Because teledentistry is just, let's say, your avenue to clinical diagnosis at this point. So the teledentistry code is used to say it wasn't in person. That's basically what it is. But you got to use a program. Right now, you could use Zoom, but you still got to pay for Zoom. I mean, you're paying for it, or FaceTime. But when you do get into it and you have a platform that you're using, you should be able to get paid for it, right?
Right.
You got to pay for that platform.
It's your time. It's your training.
It's your time. So instead of rent, think of it this way. Teledentistry is another rent. But what could you make off of that rent? That's only about $269 a month.
Right.
That's a big difference than putting lights on and doing all this other stuff for rent.
Right. And you wouldn't do it, you wouldn't jump around during the day. It could be Friday mornings for that matter.
Yeah. It could be any morning, any afternoon. You could do 2 a week, 1 in the morning, 1 in the later part of the day. I think we should get used to working around patient schedules. You might as well do it now.
And you will. And as I said earlier, Paula, that's her world, with medical and a big insurer. I can tell you that they are pushing like full steam ahead for Telemed.
Oh yeah.
For a lot of reasons. And even on the backside, you're going to find out that docs can see a lot more patients in a lot shorter time. And at some point you say, well, your reimbursement for this might be half of what it was, but you can see 5 times as many patients in the same amount of time.
And you're not paying a team either. I mean, I hate to cut out the team. I'm not saying cut out the team.
Right.
What I'm saying is you could be doing this from home.
But if you did it Friday mornings, if you just said Friday mornings is my cosmetic consult or my whatever time, and they schedule that, and you're at home or you're in your office or you're at home with a backdrop, and you just say, I'm going to see 4 patients this way with a cosmetic consult, you know, that's an amazing way to do something that would have tied up time in your practice, and you don't have a single team member. Now you could do it in your practice because you're still paying rent. You know, the electric bill.
It's always paying rent, but this is
okay.
Just a better way of doing it. Now I'm going to give you a secret, and everybody that's listening a secret. Paul is now my husband, Paul, you know, doctor.
One of my favorite people.
He loves chewing sleep apnea. He took a course on how to diagnose sleep apnea online.
Huh. Yeah.
So, and he doesn't have to see the patient right now. What he's making them is a temporary sleep appliance. If they don't want to come in, shipped right to their home.
Okay.
He's seeing them again after that, a follow-up to make sure how they're fitting it. So we're seeing sleep apnea patients online.
That is, yeah. So I think the message here is we don't know what that's going to look like, but it is definitely that direction. And integrating, and I don't think it is a replacement, but I think that docs will find that they can integrate and do more with the same or less resources. So
absolutely. And don't forget, we even with teledentistry, there's other things that you could do.
Okay.
And the other thing that you could do is have your hygienist learn how to connect with their patient list. So we started with, and I had this one doctor, he was pretty brilliant. He had 4 hygienists, different practices, of course, and each one of them learned how to use his platform. He has a platform already, and they contacted first patients that were in the middle of treatment, not completed. How could we keep them healthy while they were waiting now for the rest of the scaling and the root planing or whatever they were in the middle of? So they did contact these patients, and whatever home care products they had recommended, they were mailing them out to the patients for the fee of whatever it would have cost in the office, but he's mailing it to them. So they're keeping their patients within home care, updated, writing up the charts, going into the computer system and writing up their charts that they're doing teledentistry, because we can't forget to do that. And he has activated, every one of his hygienists has reactivated every one of their patients. They started with patients that were in treatment. Then they went to patients that they had to cancel appointments for recalls. To just connect with them again, just to connect. Wasn't even so much to do a visit, but is anything going on that we should talk about? Do you need your home healthcare products? Patients with implants, the doctor would call and say, I know that you had implants, you were due for your perio maintenance. We know how important perio maintenance is with the viability of implants today. So yeah, we're going to do some extra home care. And this is what we're recommending.
Well, millennials, I always tease and say, I own 5 millennials. But this is how they communicate. Yeah. They're used to this. So it's not, it's up to us to learn it. Again, we had a big call with my dad who's 80 in South Florida, and that took me 3 runs at the installation.
The point is he did it.
But he got it, but all of the all the grandkids, they were on their phones. They were, one of my nieces was making dinner and before she's in Florida, and this is just how they do it. So your patient is used to this. And I guess back to the Telemed, I would say this, I would be comfortable predicting that within a 3-year time period, anybody who's listening to this today will have done a Telemed visit in some form or fashion.
Absolutely.
You'll be pushed to it. My prescription renewal, they won't even let me come into the office and be bothered with that anymore. They're going to say, we only do these online or something. I don't know what it's going to be, but I know that I think the point is it's really good time to learn that. And
think about when you do open and being able to keep in touch with emergency patients, to be able to keep in touch with your hygiene patients. Don't you think that people will cooperate more now?
Yes.
Steve, in the fact that we could test their saliva for defects and issues. And when this first started, and I want to say it again, I was at the ADA meeting, and I said to them right then and there, we do oral saliva tests already. Why aren't we speaking to the companies that perform oral diagnostics and get them to be able to diagnose these viruses, right?
Okay. Yeah.
Lo and behold, what happened this last week?
Right.
Oral and you know what? They can't do those tests for patients, believe it or not, because they can't go into the oral cavity. So the patient goes and has to do it himself, put their saliva in the cup, and they're sending it to the lab. That's it. So we need to think about, why are we not contacting the health department and saying, we'll offer these tests for our patients. We'll do the saliva test for our patients and set up even a teledentistry where we can get a hold of those tests, send it to the patient, have them do it, or go into the office for it, because that to me is an emergency.
Right. And your follow-up can be done this way.
That's right. But we are connected to the body, and I've said it forever. You know that. I'm a big preacher on this, but we have a role, and it's going to get bigger and bigger and bigger, because a GP cannot do what we can do. Just doing saliva and letting our patients know, you know what, they're going to get used to this now. They're going to get used to having parts of their body tested for different things. Right. So saliva could test for cancer, it's got so many uses. It's connecting the patient's systemic infection to what's going on in the oral cavity, and we are the only doctors that could see inside a body without cutting or sticking a tube in them.
So what could somebody be doing today? I know you have, before I forget, you have a newsletter, right?
Yeah.
Okay, awesome. And when, we'll put the link again, links2success.biz. They can sign up there.
And they can sign up there, and anybody, we've done the Telemed program. We just did one, but I will be happy to put this PowerPoint up on my school site. Okay. And anybody can take it for free.
I'm going to guess, Christine, that your next 3 months or 6 months is going to be overrun with code issues and, hey, can we code for this? And hey, they just released, and I don't know how it works, but they released a batch of teledental codes to do A, B, C, and D that you can now do. So it would be a good idea for somebody that was interested in this it's a good way for them to stay in touch with you. I know your emails, everybody sort of loves the detail that you're able to go into in a way that, you just can't do on a call like this. I know that when we do live events and, the worst thing you can say is, does anybody have any questions for Christine? Because everybody does. Every hand goes up. And I know you even done them where you spend a day, at the first day of your event is talking, and the second day literally is questions and coding and walking through, the billing. And so I guess my point to that is, what it says is it's very valuable, needed, wanted information that's going to change dramatically when we all start to go back. So
Right.
one good thing is just to stay in touch with you through your newsletter.
And I've gotten a lot of questions from doctors across the country, some that I've trained, some that I have no idea who they are. And one doctor sent me a very interesting email. Do I code for taking the patient's vitals? Well, you should be taking vitals all the time. And yes, you should code for them. Absolutely. And you should do it even more now.
Is it a
temperature, blood pressure? Yeah.
Is that a medical code or a dental code?
Yes, these are medical. There's no codes in dental for this. But yes, you should do it. The other interesting question he asked is, because I have to do extra infection control, especially for us to be safe, both patient and ourselves, what disinfecting mouthwash should I be utilizing? And that was an interesting question to me. What is really disinfectant mouthwash? Well, chlorhexidine is one of them, because we use it for irrigation. So it doesn't have to be chlorhexidine. I want doctors to know that the product you use for irrigation in your office is what you should be doing before you start treating. Okay, so can you charge for that? You could charge for irrigation. Now, whether a patient's insurance covers it should not matter at this point. And I'll guarantee you that patients won't mind having to pay for that cost, because you are buying it. It's not water. You're purchasing a supply to utilize. And when you tell patients about these disinfecting things that you're doing, they are going to be grateful, and they're going to understand why, because they have been embedded with this transfer of infection.
So, that is also a great point that I hadn't thought of until just this moment. There is, you've got, whether it's fee for service or a hybrid or, whatever.
It doesn't matter if you're on insurance or
not. You have a heightened awareness. You have people who are saying, listen, I want to come into a really safe place, especially if it's, mom, dad, and 2.3 kids. Mom's bringing the kids in. She wants to make sure they're absolutely safe.
Absolutely.
And if it's an extra X dollars that it's added on for our infection control fees, and your insurance company doesn't pay for that, I can't imagine anybody saying no.
They're not going to say no.
Right.
They're not going to say no, because they've been brought to attention.
Right.
The only thing that I'm going to say, last thing, is if you have an open bay dentistry, whether it's pedo does, ortho does, they have no walls, that may be a problem.
Yes. Yes.
OSHA, it's going to come down on open bay, because on a normal basis, the particles go in the air. And I think that that's going to be a detriment. So maybe one of the things that doctors that have open bay facilities are going to have to use, like maybe one at one end and one at the other, and not be able to fill up all their chairs right away.
Right.
Maybe buy a screen.
I was going to say a plexiglass or some kind of a
screen, even these kind of screens. Put up anything, because we're going to need it. And that's going to be a rule. I know it. I could feel it in my blood when I speak to these people. They're going to look at more OSHA, and believe me, they're going to be checking.
Right. But again, the good news is, kind of on the insurance side of it, your thing, you may not need to have insurance, but you are missing out in billing. Just like billing some diagnosis, billing medical things that you could be billing now. One of the things that always jumps out at me, Christine, my thing is practice owners and how they can be profitable and increase their profit. And it's not by, charging patients for treatment they're not doing or taking advantage. It's for work that they're doing. They just don't charge for. Right. And you and I have walked through this exercise a few times. It can be tens or hundreds of thousands of dollars a year.
Yeah.
That all you have to do is, pull up the patient's medical, check a few boxes, and bill it.
And
but we don't.
No, and you know what? The smaller practices are going to come back strong.
Yeah.
You know why? because there's less people in that office, and better setup for sterilization and protection of patients, because there's not 10 doctors working there.
Right, right.
So, you know, we've been dealing with DSOs taking over. But I'm going to tell you, if individual doctors in smaller group practices don't figure this out now, they're going to lose the one opportunity they're being given to go back to private. Because they can do teledentistry a couple of times a week, see individual patients where we're protecting everybody, because we have the capability of being smaller and we know what it is to be smaller. People are going to want to come to us versus go to anywhere they have to sit.
Well, they're going to want to be comfortable with their dentist in a way that they haven't up to now. So I think you're spot on. Well, Christine, they're sending me, I'm getting a little thing that says, wrap it up, Steve. We could talk for days or hours, and have. Like I said, there is more information packed in that little package of Christine Taxin than anybody I know. And it really is, it's always, you always walk away thinking, wow, these are simple things. And like I said, if there's no other takeaway that somebody can do right now, just figure out how to start billing medical in your existing practice on work you're already doing. And it's literally money that walks out the door with every patient that you don't bill for treatment you're doing.
Absolutely. So, and if there's doctors out there that want this PowerPoint, I'll be happy to, I'm going to record it and leave it recorded so anybody could take it. There's no fee for it.
Awesome.
Just contact us at Links2Success or dental medical billing. Join dental medical billing, and the PowerPoint will be there for everybody.
Fantastic. Well, Christine, as always, I know your time is always pressed. Usually it's because you're hustling to an airport or hustling to a speaking engagement or hustling to a big client thing. I mean, so, now it's just sitting in the same chair going from Zoom to Zoom to Zoom. But I appreciate you sneaking in an hour for us.
No problem. I love being with you all the time.
Well, and you've got, again, you're one of the people that, there's a lot in dentistry that you leave and you feel like you heard something, then you go check it out and, it's a lot of fluff. You are literally the opposite end of that extreme. The value that you bring is just, like I said, the worst question I can ask when we do something is, does anybody have any questions for Christine? And it's just, bam, yes, everybody does. And you're always very generous with your time in that respect, and I appreciate that.
Well, thank you, Steve, and say hello to Paula for me.
Will do. She's, I'm sure she'll be thrilled to hear we talked, and as you will, say hi to Paul, one of my favorite people. And, with that, practice owners, I appreciate you tuning in. I'll put the link below to Christine's business, Links2Success.biz. And she is always very generous, as I said, with her resources and information and even just a conversation. And I don't think you could go wrong signing up for Christine's newsletter just to stay up on changes that we're all going to see. So
absolutely. So thank you again, Steve.
Thanks, Christine. There you go. Until next time.
Until next time. Bye. Bye.